Hello everyone! Today I am going to perform the procedure of assisting the patient during the feeding time. First is we need to do the proper hand washing. Open the faucet. Put a quarters amount of soap on your hands. Rub your palm to palm. Interlace fingers. Back of the fingers. Thumb. Fingertips. Thumbs. Fingertips. At the back of the hands. Wrist. And rinse your hands under the clean and flowing water. Dry your hands using a clean paper towel. And close the faucet using a paper towel. Done with the hand washing and the sanitizing. So next is I need to put on my gloves. The other one. Gloves on. Next would be I will going to introduce myself and explain my purpose to the patient. Hello ma'am, my name is Melody and I am your caregiver. Today I will going to assist you with your lunch. And as per your doctor's advice, you should have your meal before taking your medicines, okay? But prior to that, I need to check your vital signs. Let me check your vital signs. Vital signs check is done. Ma'am, kindly wait for 10 to 15 minutes while I'm preparing your meal, and I'll be back once the food is ready, okay? Now, I will going to prepare the meal of the patient. I must take off my gloves. Do the proper hand washing and sanitizing again, and put on a new food gloves. Food gloves is on. I will going now to prepare the food of the patient. Setting the table for the patient. Next would be, I will going to approach back the patient. Ma'am, I'm done preparing your food, but before you can start having your meal, you must clean and wash your hands, okay? Let me assist you with that. Assisting the patient to wash her hands. The patient is done washing her hands. Ma'am, let's proceed to the table. Please sit down. Kindly place this napkin on your lap to keep you clean while eating. I have prepared your meal, ma'am, according to your prescribed diet, and follows as well the 3 major food groups, which are the Go, Grow, and Glow foods. And what we have here is a plain rice that is rich in carbohydrates to give you strength, and a sinigang prawns. It is rich in omega-3 fatty acid that is good for your heart. And of course, the vegetables that is high in vitamins. And for dessert, you have a ripe banana, which is rich in fiber and potassium to help your regular digestion. So that's your lunch for today. You may now start eating and take your time.
I'm done.
Okay. The patient is done, and now I will going to ask her where she prefer to rest. Ma'am, where do you prefer to rest? On your couch or on your bed?
On my bed.
Okay, no problem. But before doing that, you need to wash your hands and do your oral care, okay? Let me assist you. Now, I will going to assist the patient washing her hands and do her oral care. The patient is done. Ma'am, let's proceed to your bed. Please sit down. Ma'am, please stay sitting upright up to 30 to 60 minutes to avoid reflux. And please allow me to clean and do the aftercare at the table. And I'll get back to you after 20 to 25 minutes to do the vital signs check, okay? Alright. Now, I will going to clean the table and the utensils that the patient has been used. I'm done with the aftercare. So next step would be I'm going to take off my food gloves. Do the proper hand washing and sanitizing again and put on a new clean gloves. Gloves is on, and I will going to approach back the client. Hi, ma'am. So I'm already done with the aftercare. What I'm going to do now is to check your vital signs, all right? Vital signs check is done. Everything is okay. Everything is normal. So we are done for today. You may now take a rest. But if you need any help or any assistance, please don't hesitate to call me.
Thank you.
Okay, thank you so much. Now I'm done for the day. So I will going to take off my gloves. Do the proper hand washing and sanitizing. And lastly, I will going to document everything on my care plan. So that's all, guys. Thank you so much for watching my video.